noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious minds.
This website makes learning so easy. I found all my resources here.
Like what you share.
The 14 bones of the facial skeleton provide the structural framework. They include the maxillae, mandible, and zygomatic bones, also the nasal, lacrimal, and vomer. The human viscerocranium, or facial skeleton, is a highly integrated, multifunctional framework. Beyond protection, it entrance portals for both life-sustaining tracts.
The viscerocranium displays a unique history. It features complex interactions, patterned by precise transcription networks, essential for reconstructive surgery.
Human face develops between weeks 3 and 8. It requires interaction between the frontonase and the segmented pharyngeal arches. These encircle the embryonic foregut.
Cranial neural crest cells are the primary origin of the viscerocranium. These multipotent cells undergo an epithelial to mesenchymal. They begin their ventral migration well before the neural tube closes. Midbrain neural crest cells migrate around the developing eye. This creates a clear boundary in the head and neck is derived from the brain. Only the pharyngeal arch neaves cross this boundary. From the dorsal neural fold, cells undergo transition. The midbrain stream colonizes the first arch. The hindbrain stream is controlled by a Hox code. They form chondrocytes, osteoblasts, and Schwann cells. The first two arches have a distinct origin. Progenitors form a vascular plexus. The second arch overgrows the others. Fusion creates a smooth neck contour. In week 5, the second pharyngeal arch overgrows, creating the cervical sinus. Normally obliterated by week 7, leaving a smooth contour. Persistence leads to branchial cysts or fistulas. The first pharyngeal arch is Hox-free. Instead, its patterning is regulated by nested DLX genes. DLX1 and 2 are expressed globally.
DLX5 and 6 are restricted to the mandibular process, while DLX3 and 4, the DLX1 distal domain, regulated by endothelin-1 signaling.
Within the first arch, distinct molecular zones are established. Dorsal genes direct the fate of the maxilla. Ventral factors like HAN2 dictate the mandible. Knocking these out causes a duplicated upper jaw. In DLX5-6 double knockout mouse models, Meckel's cartilage is completely absent, and the lower jaw transforms into a mirror image upper jaw, with ectopic whisker pads appearing on the lower jaw. By the loss of HAN2. Alongside the expansion of PAU3F3, genes like RUNX, PAX1 regulate nasal morphology, while the EDA gene regulates chin projection. In the endochondral pathway, cartilage is replaced by bone. This forms the middle ear ossicles. In this pathway, highly vascularized mesenchymal condensations undergo direct osteoblast differentiation to form the flat and irregular bones of the face. The mandible exhibits a unique condensation forms lateral to Meckel's cartilage, initiating intramembranous ossification near the division of the inferior alveolar nerve.
Secondary cartilages appear later. By week 14, they ossify. But the superior zone persists as articular cartilage, guiding growth of the mandible.
The mature human viscerocranium is composed of 14 distinct bones. These include 6 paired structures and 2 unpaired midline structures.
The midface is anchored by the paired maxillae. These fuse at the midline via the intermaxillary suture. It consists of a body and 4 processes.
The body of the maxilla houses the maxillary sinus, the largest of the paranasal sinuses. This body features the canine fossa, situated lateral to the canine eminence.
The zygomatico-alveolar crest is a thick bony ridge, located inferior to the zygomatic process. It is a key reference in surgery and fracture classification.
Located in the anterior hard palate, The incisive canal transmits vital structures. It contains the nasopalatine nerve and sphenopalatine artery.
The maxilla is highly integrated, articulating with every bone in the face except the mobile mandible. The palatine bones situated posterior to the maxilla. Each consists of 3 proceps.
The horizontal plates articulate medially at the median palatine suture, the vertical perpendicular and the medial wall of part of the latigal nasal wall.
The palatine bone features 2 key neurovascular conduits, the greater palatine foramen, located posterolaterally near the 3rd molar in the pyramidal process, mixed to soft palate. The zygomatic bones form the cheeks, appearing as distinct diamond-shaped structures. Its frontal process projects superiorly, featuring the orbital tuner aspect, serving as a critical attachment site.
The temporal process projects posteriorly to meet the zygomatic process of the temporal bone, completing the zygomatic arch, serving as the origin for muscles.
The maxillary process projects antero-inferiorly. It articulates with the maxilla. This forms the lateral infraorbital rim.
The zygomatic bone houses the zygomatic orbital foramen on its orbital surfatal surface, which leads into the zygomatic canal and branches to LE nerve 2.
The nasal bones are 2 small, oblong plates joined at the midline via the internasal suture to form the bony bridge of the upper third of the nose. The outer surface is concavo-convex. The nasal bones articulate superiorly with the frontal bone, laterally with the maxilla, and posteriorly with the ethmoid plate. This forms the keystone area, essential for support and the internal nasal valve. The lacrimal bones are the shape of a fingernail, situated in the anterior portion of the medial orbital wall. This groove completes the lacrimal, housing the lacrimal sac. At the base of the posterior lacrimal crest is the lacrimal hamulus. It articulates with the maxilla to complete the nasolacrimal canal. Medially, it forms part of the middle meatus and closes the ethmoidal air cells.
The inferior nasal conchae are independent bones. They project from the lateral walls of the nasal cavity. Each features 3 delicate processes on its superior border.
Each inferior concha features 3 delicate processes. The maxillary process projects laterally to articulate with the maxilla, closing a portion of the maxillary hiatus. To articulate with the uncinate process of the ethmoid bone, meatus, which receives the opening of the nasolacrimal duct. The vomer is a thin, flat, plowshare-shaped bone. It forms the postero-inferior nasal septum. The lateral surfaces feature the vomerine groove. This transmits the nasopalatine nerve. The superior border. It features 2 wing-like expansions, articulating with the rostrum and vaginal processes, forming the vomerovaginal and palatovaginal canals.
The vomer exhibits 4 distinct borders. The inferior border articulates with the nasal crest, formed by the maxillae and palatine bones.
The vomer exhibits 4 distinct borders. The anterior border is the longest border, slanting antero-inferiorly, fuses with the perpendicular plate of the ethmoid superiorly, and the nasal septal cartilage inferiorly.
The vomer exhibits 4 distinct borders. The posterior border is a free, concave margin, called the vomerine crest of the choana. It separates the posterior nasal apertures.
The mandible is the largest and only mobile bone of the facial skeleton. It consists of a horizontal body and 2 vertical rami. The body features the external symphysis at the midline. Its superior border houses the lower dentition.
On its external surface, the mental foramen lies inferior to the compremolar, situated approximately 12 mm superior to the lower border of the mandible, and transmits the mental nerve and vessels.
Internally, the mylohyoid line runs obliquely, serving as the attachment site for the mylohyoid muscle and separating the sublingual fossa superiorly from the submandibular fossa inferiorly. Each vertical ramus projects superiorly. The anterior coronoid process serves as the insertion site. The posterior condylar process consists of a neck and condyle, articulating to form the synovial joint.
On the medial aspect of the ramus, the mandibular foramen is shielded transmits the inferior alveolar nerve and vessels, which divide into incisive and mental branches near the mental foramen.
The hyoid bone is a unique, U-shaped bone. It is situated in the anterior neck. It is derived from the 2nd and 3rd pharyngeal arches. The hyoid consists of a central body, 2 greater horns, and 2 lesser horns. The greater horns project posterorbitally from the lateral ends of the body.
The hyoid bone is a unique structure. It is suspended from the styloid but supports the tongue and provides attachment sites for neck muscles, playing a vital role in swallowing and speech.
The orbit is a pyramid-shaped skeletal cavity. It houses the eye and vascular networks. It is formed by the articulation of 7 bones.
The orbit is composed of 7 distinct articulations. These include both cranial and facial bone structures.
The roof is formed by the orbital plate of the frontal bone of the sphenoid. Anterolaterally, it features the fossa for the lacrimal gland, and anteromedially, the trochlear fossa serves as the attachment pulley. The orbital floor is formed by the maxilla, zygomatic, and palatine bones. It features the infraorbital groove, which is a key clinical weak point prone to blowout fractures, formed by the zygomatic bone and the greater wing of the sphenoid. This wall is the thickest and strongest in the orbit, separating it from the temporal fossae.
The medial wall is formed by the frontal process, lacrimal, and ethmoid bones. Its lamina papyracea is paper-thin. Infections can breach it, causing orbital cellulitis.
Key neurovascular communication channels in the orbit include the optic canal, located in the lesser wing of the sphenoid, transmitting the optic nerve and ophthalmic artery.
Key neurovascular communication channels in the orbit include the superior orbital fissure, a cleft transmitting the oculomotor, trochlear, and abducens nerves. Also, the key neurovascular communication channels in the orbit include the inferior orbital fissure, transmitting the maxillary nerve, its branches, and the infraorbital vessels. The nasal cavity is a central respiratory passage, divided into two symmetric chambers by the nasal septum. It opens into the nasopharynx.
The roof, narrow and high, formed anteriorly by the nasal and frontal bones, centrally by the cribriform plate of the ethmoid, and posteriorly by the body of the sphenoid.
The floor is wide and smooth, formed by the palatine processes of the maxillae and the horizontal plates of the palatine bones, which collectively comprise the hard palate.
The medial wall, or septum, is composed of the perpendicular plate, vomer, and cartilage. It is rarely perfectly centered. Deviation can obstruct airflow and compromise sinus drainage.
The lateral wall has an irregular surface. The superior meatus receives drainage. The middle meatus features the bulla ethmoidalis. The inferior is the largest meatus. The sphenoidal recess is superior. A bony spur may compress the lateral wall. Concha bullosa is a pneumatized turbinate. It narrows the meatus, obstructing drainage. Septal pneumatization presents as an air-filled space.
The pterygopalatine fossa is a small, inverted pyramidal space. It functions as a crucial anatomical crossroads. It facilitates perineural pathological spread.
The foramen rotundum is a key pathway in the middle cranial fossa. It transmits the maxillary division of the trigeminal nerve, connecting directly to the pterygopalatine fossa.
The pterygoid canal, or Vidian canal, connects the middle cranial fossa to the pterygopalatine fossa. It transmits the Vidian nerve and the Vidian artery. These supply key structures in the face.
The sphenopalatine foramen serves as a crucial gateway. It connects the pterygopalatine fossa to the nasal cavity, bringing the sphenopalatine artery to supply the nasal cavity's lateral wall and septum. The inferior orbital fissure. It connects the orbit to target fossae. It transmits the infraorbital nerve and vessels. These supply the face and midfacial regions. The pterygomaxillary fissure serves as a crucial pathway. It connects the infratemporotine fossa. It transmits the terminal of the maxillary artery and the posterior superior alveolar nerve. This is the greater palatine canal. It connects to the hard palate. It transmits the greater palatine nerve and descending palatine vessels.
Let's review the lesser palatine canal. It connects to the oral cavity, specifically the soft palate and tonsil. It transmits the lesser palatine nerve and vessels. Great for a quick anatomy review.
The pharyngeal canal is a small pathway. It transmits pharyngeal nerve from CNV2, along with the pharyngeal vessels. These supply the roof of the pharynx.
The pterygopalatine fossa is a major pathway for disease. Tumors of the hard palate can travel retrograde along nerves, infiltrating the fat within the fossa and entering the cavernous sinus via foramen rotundum.
Like what you shared.
Noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious minds.